All right, ready to dive deep into nutrition and health. Seems like everyone's talking about it these days, and it's especially relevant for someone like Tyrone.
Yeah, Tyrone, he's a good example of why all this matters. 46, account executive, travels all the time for work. Now he's got prediabetes and hypertension.
That's a real wake-up call, right?
Yeah.
And both those things are tied to diet and lifestyle.
Absolutely. It's fascinating how much we can actually impact our health just by the choices we make every day.
Exactly. So, where do we start with all this? There's so much info out there. Overwhelming, almost.
You're telling me, right, it can be. Well, we've got these dietary reference intakes, the DRIs.
DRIs.
Yeah. They sound all official, but you wouldn't really use them to, plan your meals every day.
Right. So are they more for like scientists and dietitians then?
They're important, but yeah, they're more like the foundation for nutrition experts, not
Right.
something you'd use directly.
Okay, that makes sense. So if I'm not measuring out vitamins based on the DRIs, what should I be focusing on?
Well, nutrition advice is shifting, moving away from those individual nutrients, looking more at the whole picture now.
More big picture, less tiny details.
Exactly. We're talking about dietary patterns. It's the combo of foods and drinks you have over time, and there are good patterns and not so good ones.
So like constantly going for fast food and sugary drinks, that'd be a pattern, but not a good one.
You got it. But someone eating lots of fruits, veggies, whole grains, and lean protein, that's a much healthier pattern.
So it's consistency more than like obsessing over one meal or one specific thing.
That's it. And then there's nutrient density, too, getting the most nutrition, for your calorie buck.
Foods packed with vitamins and minerals, but not tons of calories.
Exactly. Would you rather have a sugary soda, basically empty calories, or a salad with lots of vitamins and fiber?
Salad for sure. Well, maybe a soda sometimes. But I get what you mean. Making those nutrient-rich foods the base.
Right. It's not about never having treats. It's about smart choices most of the time. Now, researchers, they use this thing called the Healthy Eating Index, or HEI, to measure how well people are doing with their diets, based on the recommendations. And guess what?
Let me guess. Most people aren't doing great.
You got it. Average score is 59 out of 100. Not good.
So where are we all going wrong then?
Not surprising, really. Not enough fruits, veggies, or dairy, and too much saturated fat, added sugar, and sodium.
Classic case of too much bad stuff, not enough of the good stuff. Thinking about Tyrone, with his busy schedule, sandwiches, fast food, steak dinners, he's probably not scoring high on the HEI, huh?
Probably not. But before we decide anything, gotta consider his lifestyle, too.
Right. He's on the go all the time. Probably tough to find healthy options when you're traveling.
Exactly. And think about the stress, too. That kind of work can lead to some not-so-healthy ways of coping.
Like late-night snacking, or maybe one too many glasses of wine after a long day.
You got it. So we can guess about his diet, but we need the whole picture before judging.
Makes sense, like a detective case. All the clues to figure out his health habits.
Right. And that's where lifestyle medicine comes in. But we'll get to that later. For now, let's see how all this actually impacts our health long term.
So we've talked about dietary patterns, nutrient density, all that. But how does it actually affect our health? Like good nutrition versus bad over time?
Well, think of your body as a machine, right?
Good.
Complex machine. Every part needs the right fuel, the right maintenance. Good nutrition, it's like giving that machine premium fuel, keeping it tuned up.
So it's not just about avoiding disease, it's about being your best.
Exactly. Healthy pregnancies, normal growth in kids, healthy weight. It even helps manage conditions you already have.
Like a health savings plan, but for your body.
That's a good way to put it. Speaking of long-term, there's this thing called Healthy People 2030 in the U.S.
Yeah, I've heard of it. It's all about improving health across the country, right?
Right. And nutrition's a huge part of that. They have goals like increasing fruits and veggies, reducing sugar and sodium, even tackling iron deficiency in kids.
So trying to make a real difference in the nation's health, huh?
Yeah. But honestly, there's a lot of work to do, especially with chronic diseases rising like they have been.
Kind of scary. Heart disease, cancer, stroke, diabetes. Huge problems these days.
And the thing is, a lot of them, they're preventable.
That's hopeful, but also kind of daunting. So what are the things we can actually control, the risk factors?
Well, we've been talking about poor nutrition. That's a big one. Not enough fruits and veggies, too many sugary drinks, too much sodium. All those foods high in sugar, saturated fat, sodium, it all adds up.
Like slowly damaging your health without realizing it.
Yeah, that's how it goes sometimes. then their smoking's still a huge problem.
I know. You'd think people wouldn't still smoke, knowing the risks. It's like knowing something doesn't mean you'll act on it.
So true. And drinking too much alcohol, that's another one. Lots of preventable deaths there.
Easy to forget about those extra drinks, how they add up over time.
Right. And then there's not being active enough.
The sedentary life. So many of us stuck to our screens all day long.
Yeah, and that lack of movement, it's serious. Heart disease, type 2 diabetes, some cancers, obesity.
So back to Tyrone. Sounds like he might be hitting a few of these risk factors.
Maybe. Let's think about it. Busy job, travel, what we think about his diet. Which of these things might apply to him?
Well, we talked about the diet stuff. And if he's always traveling, exercise might be tough. Plus, all that stress could lead to, like, overeating or using alcohol to unwind.
All good points. We don't know about his family history either. That plays a role sometimes, too.
Like solving a puzzle, trying to put all the pieces together.
Exactly. But the good news is, even if some of these things apply to Tyrone, he can change things. And that's where lifestyle medicine comes in.
Okay, yeah. Tell me about that. How's it different from regular medicine?
It's a whole different way of thinking. Instead of just treating symptoms, you know, with meds, it's about the root causes, changing your lifestyle.
Taking charge of your health, right?
Yeah, it's proactive, holistic. Medication might be part of it, but it's not the main thing.
Makes sense. Changes you can actually keep up with long term.
Exactly. And it often involves a whole team, different healthcare people, looking at the whole person, you know, home, work, support system, all of it.
Not just a one-size-fits-all thing.
Nope. And motivation matters a lot. It's got to be something the person wants, not forced on them.
Tyrone mentioned being into natural remedies. Sounds like lifestyle medicine would fit right in.
It could. What do you think would appeal to him about this approach?
Well, if he's looking for natural ways to be healthier, this is it. It's about change from within. Diet, exercise, stress management, those positive habits.
That's a great point. He's in control of his own healing. Speaking of exciting new things, ready for some nutrigenomics?
Yes. I've been waiting for this. It's like sci-fi stuff.
It is pretty amazing. It's all about how the food we eat interacts with our genes at the molecular level.
So personalized nutrition based on your DNA.
That's the goal. It's early days, but there's a lot of potential.
Can you give an example? How it works, I mean?
Sure. There's this gene, the FTO gene. Some variations of it, they're linked to being more likely to be obese.
So some people are just, like, genetically more likely to gain weight.
Right. But here's the interesting part. Research suggests that a high-protein diet, it might counteract those gene variations.
Wait, so even if you're predisposed to something, you can change how those genes work through what you eat?
That's the idea. Needs more research, of course, but it shows how powerful this could be.
It's like changing your destiny with food. What else can this do, potentially?
Lots. Imagine foods designed for specific genes, like functional foods.
So food custom made for you, based on your DNA.
Exactly. And it could help with health disparities, you know, how genes and food interact differently for different people.
This could change healthcare completely.
It really could. Preventing or managing chronic diseases all through personalized nutrition.
That's an amazing thought. But we got to remember, most of these diseases, they're complex, right? Not just genes.
Absolutely. It's a powerful tool, but not a cure-all, just one part of the puzzle.
Wow, this deep dive has been pretty amazing. From those super specific DRIs to the big picture, like dietary patterns. And now this nutrigenomics. Mind-blowing.
It really shows you how much we're still learning, you know, about food and our bodies.
I'm really fascinated by the personalized nutrition thing. Imagine a diet just for you based on your genes, like a roadmap to perfect health.
It's super exciting, for sure. But even without all that gene stuff, there's a lot we can do right now, you know, just by making better choices.
That's true. This has definitely made me think about my own habits, like those nutrient-dense foods we talked about. Maybe time to swap the afternoon cookies for, I don't know, some almonds and fruit.
It's those small changes that add up over time, finding what works for you.
Building a foundation for a healthier life.
That's it. And it's never too late to start.
Here's something to think about. If you could get a personalized diet based on your genes, would you? What's exciting about that, and what worries you?
Good question. The more we learn about this stuff, the more we have to think about, right? Like access, ethics, the whole future of healthcare.
We've covered a lot, but it feels like we just scratched the surface. This whole nutrition and health thing, it's huge.
Always more to learn.
So until next time, keep exploring, keep asking questions, and keep diving deeper, into the stuff that helps you live your healthiest life.
And remember, every bite you take, it's a chance to nourish yourself, to fuel your well-being.